Hello everyone, thank you for joining me for this presentation on using social marketing in public health. I believe you'll find this presentation valuable because I'm going to cover ways that social marketing can be used to make a positive impact in health promotion and behavior change. This presentation will include a very brief description of social marketing in public health. Next, I want to discuss the differences between social marketing for health versus health promotion. And finally, I'll wrap up to discuss using social media as a component of social marketing and health promotion. So some basic pointers about social marketing and public health. Social marketing is not a theory, but an approach to promoting health behavior. It uses commercial marketing techniques to influence the voluntary behavior of audience members and promotes behavior change in targeted groups of individuals in several ways. And before we move on, since we're always talking about influence in public health, I found a pertinent quote which also goes along nicely with the image above it. And the quote reads, "Influence may be the highest level of human skill." So that's something to think about as you look at the image above the quote, which is a world map made of ripples. How can you relate that to influence and social marketing? Social marketing influences people to accept a new behavior, reject a potential behavior, modify a current behavior, and/or abandon an old behavior. Some of the important components of social marketing are audience segmentation, which means dividing audiences into smaller markets of similar people. Next, market research. You must know and understand your audience's behaviors and perceptions. And then the exchange theory, which is the idea that people will accept, reject, maintain, or modify a behavior if the benefits exceed the cost. Of course, the core of social marketing is the same as commercial marketing because both are centered around the customer. So this is where the 4 Ps come into play. The product, which is the good, service, or idea. Price, which are the costs or barriers to the behavior change, whether it's money, discomfort, etc. Then place, which is pretty self-explanatory. And finally, promotion, which are the tactics used to communicate the message or behavior changes, such as pamphlets, radio ads, brochures, and more. Now that we've discussed the basics of social marketing and public health, let's look at the differences between social marketing versus health promotion. They certainly have many similarities and common goals, but they are a little bit different. So I'll read through these tables with you, and then we'll expand on some of these points. So for social marketing, behavior impact is the main goal. It focuses on short or medium-term success, draws from commercial sector marketing research, sees people as customers or consumers, and there's an emphasis on building lasting relationships within the communities, and social capital is a means to an end. For health promotion, the aim is to improve health and reduce inequalities. There's more of a focus on advocacy, and it centers around long-term success and sees people as co-producers, not consumers, and enables communities to define their own health needs and then empowers them to take action. So now I'd like to read an excerpt from the article referenced on this page. This is from the National Social Marketing Center in the UK, and I think they do a good job wrapping up the main take-home points when comparing these two elements. The article states that social marketing is fundamentally focused on people's behavior. Its driving purpose is to achieve tangible and measurable impact on actual behavior. Reducing health and social inequalities is an outcome rather than a primary goal. It is distinct from health education in that it goes beyond informing or persuading people to reinforcing behavior with incentives and other benefits. It goes beyond communicating or sending of messages and should not be confused with the more limited social advertising approach, although it can encompass that, but it would rarely just be that alone. Okay, so the focus with social marketing was on behavior change, and for health promotion, the focus is more of a wide range goal of health, well-being, and equality. As the article puts it, health promotion is focused on health and well-being outcomes, i.e. improving individual and population health, and reducing health and social inequalities. It aims to empower people and communities to control their own health and well-being by gaining control over the underlying factors that influence health and well-being. The main determinants of health are people's cultural, social, economic, and environmental living conditions and the social and personal behaviors that are strongly influenced by those conditions. So just a little recap before we move on and switch gears a little bit. So far we've covered the basics of social marketing and public health, and we've looked at public health versus health promotion. And I also think it's worth mentioning that health promotion and social marketing work best when they are together. In fact, health promotion should always be a huge component of social marketing and public health. Hopefully that makes sense. The influence landscape. As we surge right ahead, try to remember that the overarching idea of this presentation is to talk about the power of influence. And for our purposes, the vehicles carrying influence are social marketing, health promotion, and social media. So I wanted to share this diagram with you. As you can see, it's from the Advanced Human Technologies group, but I believe it fits well into our purposes of health behavior. And for this presentation, look at how many times the words social and social media are mentioned, and then the words related to them, like blogging or Twitter. They're everywhere. That's because, like I said, social media is another important vehicle that really has the power to influence a lot of people. And probably most of us can anecdotally recall a time when we said something on Facebook or Twitter and it had an influential effect. I know I can. I consider myself responsible for several presidential votes because of my stance on Facebook, the articles I share, the things I say, etc. And again, that's my perception. It may not be accurate perception, but nonetheless. So again, I think this is a good tool. This diagram puts everything into perspective, and it's also a good transition to talk about social media and public health. So now on to social media, which includes but is not limited to Facebook, Twitter, blogs, podcasts, online video sharing, e-cards, RSS feeds, widgets, and much, much more. Obviously, social media is an amazing outlet for health promotion because it allows for creativity. It's generally very inexpensive, efficient, and you can reach loads of people. And let's not forget that it's people's favorite addiction. So some other things that make social media special are they increase timely dissemination and potential impact of health and safety information. You leverage the audience to facilitate information sharing. It expands reach and includes more diverse audiences, personalizes and reinforces health messages that can be tailored or targeted to particular audiences, and facilitates interactive communication, connection, and public engagement, and empowers people to make safer and healthier decisions. If you look at the example I have posted on the right, this is from a blog in the United Kingdom for the breast cancer campaign. And if you'd like to visit their site, it's right underneath the picture. It's www.breastcancercampaign.org. And this is part of a campaign called Wear It Pink. You basically put your face into the caricature, and then you can share it on Facebook to show that you're a Wear It Pink superhero. Obviously, the idea is that it creates breast cancer awareness and gets people talking, and if you share it on Facebook, it's more likely that you're going to influence others to share it on Facebook, so you're spreading the word and raising awareness. So this is just one cool reference I found on the social media front, and I think that the UK has the cool factor nailed down, and it's a great model for the US breast cancer campaigns. So now we're going to delve into some of the tools needed to use social media in public health, and luckily the CDC has a very detailed 50-page document that sorts things out nicely for people who either want to increase their ability or maybe they're new to the social media scene. So for this presentation, I'm going to touch on some of the biggies, and again, the reference is on the bottom right if you'd like to do some further investigating. Since we just looked at the UK's breast cancer media, I wanted to show you a smaller example of a health communication, and this one's based out of Putnam County. It's called Heals for Healing, and it raises funds to fight domestic violence. So I just want to bring home the point that a lot is possible with social media, even for smaller groups or communities or small budgets. There's just a variety of tools out there that can be integrated into communication programs, and the tools that are available range from easily downloadable products like widgets and badges, which take minimal resources to use, and all the way up to tools that engage two-way communication and ongoing interaction like social network sites or even texting. And the latter use more resources and may require specific expertise or leadership in those areas. But according to the CDC's social media toolkit literature, it's beneficial to start with social media projects that may be considered low risk or use fewer resources on the onset, because that way you're more familiar with the territory. And then as you go, you can adopt more engaging tools, which might require more resources or expertise. So for instance, you're just going to take little steps. If you're familiar with Facebook, start there with a campaign that's geared for Facebook use. And remember that social media is part of the larger communication marketing campaign. Always keep the objectives at the forefront. So it's extremely important that before you begin implementing social media, your social marketing plan should already be hashed out, meaning you already identified the target audience, you've determined objectives, you already know the outlets, and you've decided on the amount of resources, of time and effort that can be invested on whichever social media tool that you believe is the best fit for your campaign. Which brings us to our next slide. This table is a quick guide on how many resources are used for each type of social media. So if you look at buttons and badges, that's on the low end. E-cards on the low end. Some of the moderate stuff like podcasts and online video production, blogging, that takes a lot of time. Virtual worlds and social networks is kind of like in the medium high. So that just gives you an idea. So again, something to think about beforehand is how much time and effort your group can afford for whatever type of social media they are interested in or think is the best fit. So that brings us to our video example. This is a very brief video to give an example of one method of social media sharing to communicate a health message. I like it because it's quick, but it's also effective.
All right. Going to the hospital can be scary enough. But if you lose your job, you can lose your insurance. Or if you have pre-existing conditions, you may not be covered. Or if you get too sick, you may be dropped altogether. Yes, going to the hospital can be scary, but going to the hospital without comprehensive health reform, now that's really scary.
So that video is less than 1 minute long, but I think it sticks with you. So that's the kind of thing that you want to look to do when you're using these social media type things. You want to appeal to your audience and have a message that really comes across and sticks with the person that's watching it. I hope you enjoyed this presentation and that it piqued your interest in social marketing and social media as ways to positively impact public health. Always keep in mind that if you have the ability to influence someone, you can make a huge difference in many. So now you can add social marketing and social media to your public health toolbox. Feel free to visit these references I have listed, especially the CDC's Social Media Toolkit. It has tons and tons of information that I could spend hours talking about. There's something in there for everyone, no matter what your skill level is with social media. It's a great tutorial and it gives lots of examples. Also, if you have any questions or feedback, you're welcome to contact me via email at ashley.johnston@unf.edu. Thanks for joining in this presentation.